All right, welcome everyone to Pure and Simple Health. My name is Dr. Ruben. I'm a licensed pharmacist and I practice alternative medicine. And my goal in this life is very simple. It's to share the secrets to never needing medication again. Now that's really intense because I'm saying as a pharmacist, sharing the secrets to never needing medication again. Now there are times when the person needs medications, absolutely. In critical care, in emergency care, when you have an accident, we have the best medicine in the world to save your life. Now, what I'm speaking of in terms of not needing medication is when it comes to chronic disease. Because unfortunately, when we apply the critical care model of the Western medicine to chronic disease, nothing good happens. As is shown in our society, more and more people are diabetic, they're suffering from diabetes, obesity is growing, Alzheimer's is growing, cancer. I guarantee everyone will raise their hand if I ask them who themselves or know someone that has any of the top 5 killers, which is heart disease, Alzheimer's, diabetes, and pulmonary issues. Everyone in the room knows someone who suffered from those. And inevitably, all those people are put on some medications by their physicians, right? And they're told that this is the only thing that's ever going to help them to treat the disease or treat the symptoms of disease, and if they don't take it, they're going to die, right? That's what we've all been told. Now, today's session is educational purposes only. I'm not here to act as your medical doctor, and I cannot answer any specific medical questions related to you or anyone you know, only general questions I can answer. And if you want to have one-on-one consultation with me regarding specifics, I'm more than available. First thing I want to talk about is about drug safety. The reason why it's so important topic is because more than 100,000 people die every single year from side effects of medication. Now, I'm not talking about heroin addicts or people using illicit drugs or overdosing on medication. I'm talking about people that use medication as prescribed by their doctors. When it's used as prescribed, still over 100,000 people are killed based on the toxicity of these medications. Okay, so that's really sad statistics, and that's why I want to talk medication safety, because in pharmacy school, we're taught to make sure the patient's on the lowest effective dose of a medicine for the shortest amount of time. And what's the third one, Christina?
Oh my God, I'm getting quiz. With the least side effects, I don't know.
Oh, okay, let me just go over it again. The lowest dose, least amount of time. What's the third one?
Duration. Well, duration. I don't know.
Okay, there's a third one. I apologize.
It's cloudy.
Anyway, the reason that is because all medicines, all drugs are toxins. The only thing that makes them therapeutic is the dosage, making sure that the risk outweighs the benefit, or the benefit outweighs the risk. So we have to make sure that it's not gonna kill you, and it hopefully will make you a little better. Now, this is a classic example. Look at cancer drugs, for example. In a healthy person, if you take a cancer medicine, it will cause cancer in you. They're called cytotoxic, teratogenic. These are all things that cause cancer. How does that make sense that we're using something that will cause cancer to treat cancer? Doesn't make sense to me, right? Doesn't make sense to you. Why do we use those things? Because those are the only things that can be labeled as drugs. And drugs are the only substances by the FDA, by the government, that can say they can cure or treat or prevent a disease as medicines, drugs. And the only way that a drug can happen is because if the companies that produce them can have all these millions of dollars of studies that show that it's effective. And the only company that's willing to invest all that money is a company that's has patented a chemical that has never existed in nature, because we cannot patent anything in nature. So by definition, no natural product can be called a drug, and no natural product can cure, treat, or prevent a disease. Now that to me is totally bogus as an individual, my personal opinion, because the society has been curing and helping people with chronic diseases for centuries. The Chinese medicine, Ayurvedic medicine, even homeopathy, which has been around a few hundred years, they've all done it safely without killing people. You know, known amount, you know, herbs are really very safe. There's only been there's actually has not been one single death from a natural product when it compares to its drug counterparts. And even so, many drugs have actually been recalled from the market because of the high death rates that it's caused after the FDA has said it's safe and effective. So we have to make sure that our health is our responsibility. We have to take personal responsibility for our own health. We cannot put it in the doctor, in the hospital, or in the pharmacy. So that's one of the reasons why I set up today's session, is because I want to teach you what you need to know if you view any medication, how to use them safely, and more importantly, what you need to do to stay healthy. Because by definition, if you stay healthy, you're going to prevent disease. You cannot be sick and be healthy at the same time. So the doctors that tell you, or the patients that tell you, oh, I have this and this disease, but my doctor says otherwise I'm healthy. That can't happen. You know? So anyone that's telling you that is total lie, just to make you feel better. You know? So it's all about how you define health. So, how we define health. The World Health Organization has an amazing definition of health. And it's like this. It's the complete physical, emotional, and social well-being, not merely the absence of disease or infirmity, which is injury. So just because you don't have a diagnosis of a disease does not mean you're healthy. It's very important. Whereas our medical model, oh, you're fine, you don't have this disease, you don't have that disease, okay, you're healthy. That's not the case, because a person is a ticking time bomb. You know, all these pre-diabetics, our kids are becoming diabetic now, it's because all the junk that they're eating and all the vaccines and all these toxins they're being exposed to. So they're not healthy along all those time before they get diagnosed with this diabetes or autism or whatever else they're finding in these young children nowadays. Let's talk about how drugs actually work, because a lot of people are really confused about it. Any idea how drugs work from the crowd? Except the pharmacist?
Kind of. I think that they address the symptoms,
Okay.
and they don't cure anything.
Okay, great. So what is a symptom?
It depends on what the illness is.
Yeah, just as a definition, what is a symptom? Pain is a symptom,
Pain,
good.
number one. I would
Pain,
think that's-
you have, you know, the things that you can measure, you know, like blood pressure, blood sugar, the tumor size,
Yes.
you know, how you're feeling, all the things you can measure. So in all these fancy commercials you hear about, this medicine is used to treat the symptoms of blank disease. All you hear is a disease. You don't hear the word symptom, because by definition, you know, if we don't feel sick, then that means we should be healthy, right? It's not the case. So all these cough and cold medicines that you have on over the counter, they do nothing to help you with a cold and cough. Nothing. If anything, they lower your immune system. There's been studies to prove that. What they do is they make you not feel the runny nose, the fever, the aches. It makes you just makes you comfortable. So that way your body can go through the natural healing process, and that way you don't feel like, you know, truck just hit you. Which you know, in some cases you do need that palliative care. But people that are interested in actually curing or preventing a disease, that's not the route to go. Okay? Because the way the drugs work is by one chemical attacking or blocking one receptor in the body. That's it. It's a linear model. So that means the problem with that is also, you know how they say at the end of the drug commercial, they list all these huge number of lists of side effects,
Yeah.
right? Why is that? Because these receptors are located all over the body. They're not located just in your lungs for an asthma medicine, or just in your heart if you're taking heart medicine. They're literally located everywhere in your body. So all these side effects, they're attacking the same receptor. It's just different parts of the body. So they're calling it a side effect. It's actually part of the effect of the drug. You know? So you have to be very careful in how we define, you know, a medicine. Because most people are not aware that the way that drugs work, they attack certain receptors and they block a metabolic function. And this metabolic function is located everywhere, not just in one place. Okay. Now, I have not a funny story, but a very sad and something that is very, very important. which is what's the best way to take medication? If a person has to take medication, like rescue inhalers, or medication to treat seizures, right? Emergency medicine. A lot of people do not use them correctly, and a classic example is asthma medicine. So people that use it as perfume, people that use it as a mouth spray, it's totally wrong. I'll give you an example. This is an actual story. It happened to me a few weeks ago. In the pharmacy, a patient came in from Mount Sinai Hospital with 2 prescriptions. One for a albuterol inhaler, which is a rescue inhaler, and one for prednisone. And I noticed that they got the same exact regimen a week earlier. I'm like, you have 2 emergency, attacks? Well, what's going on? It's like, only these pills work for me. Without these pills, prednisone, I get it back. I'm okay. How are you using your inhaler? Because he's like, yeah, I finished it. It doesn't work for me. Okay. He puts it in his mouth, and that's it. Totally wrong. So I said, okay, in the emergency room, no nurse taught you, no doctor. When you filled the last prescription, no pharmacist taught you how to do this. You didn't read any packaging, so you didn't look online, nothing. No, my doctor gave me. This is my prescription. Gave it to the pharmacy. I had 0 co-payment. I went home and just started doing this. That's it. The problem is this: because the people are non-educated about how to use medications correctly, they're going to keep going back and costing the whole healthcare system more and more money. So I took like 20 minutes, busy schedule, and I said to them, okay, this is how you use it. You have to exhale deeply, shake the canister well, put it over your mouth, put your mouth over the mouthpiece, start inhaling, and as you're pushing down, keep inhaling, and then hold your breath for 5-10 seconds. And he actually did that in front of me. I said, okay, open the package and do it. Wow, I actually feel relief. If he did that right the first time, he wouldn't have to go to the emergency room, and that's a big issue. Now, the reason I mention that is because I have so many people that call pharmacy or come and walk in here and say, I had this emergency, okay, you have to go to the emergency room. Well, I don't have to wait there for 10 hours, and they're going to send me home, what do I do? It's because all those other people taking up so much time in the emergency room when they actually need emergency care for these chronic issues, that if we just educate them more, it won't even happen. Just because people know how to use the medications correctly. So imagine a person who takes 10, 15 drugs. What kind of mess that is? Because that's a full-time job trying to manage that.
What do you do with the body?
Yeah. And part of my goal is to help for people to minimize their need of medications by helping them by making them healthier to alternative medicine. We can actually help to decrease their body's need for these medicines to keep them alive. So there's other things to consider when using medication correctly, right? Depending on the medicine that you need to take, you have to make sure you have to understand whether or not to take it with food, how to space it from other medicines, okay? How to space it from other foods. For example, some antibiotics you cannot take at the same time you're taking any kind of antacids or calcium or dairy, iron products. Otherwise, it won't work. And some people, in the summertime, they go on vacation, have to take an antibiotic, different type of antibiotic, and you're not supposed to be out in the sun when you're on this antibiotic. It makes your skin very sensitive to the sun. And they wind up with, 2nd-degree sunburn, right? So you gotta be extra really careful, because don't forget, all these drugs, even over-the-counter products, they're all toxic. And if you're gonna use them, you have to make sure you're really responsible and know exactly what you're doing. Okay, educate yourself. Now, the best resource is a pharmacist or a doctor, but also a lot of these websites and YouTube and all these other websites that actually help you teach you on how to use medications correctly. So that way, if you don't want to take up their time, you don't take up your time, at least you can learn from the internet. It's very, very important. Okay. Now, I want to get into some of the drug classes, because a lot of people, they have a lot of misconception about certain medicines. So there's a lot of things I can talk about. I don't want to just make this a pharmacology lecture. So I want to know from you, any medicines that you're familiar with that you want more information about, how it works, or anything I can answer about a specific class of drugs. For example, anti-anxiety medicine, people have reflux, medicines.
I
acid reflux.
Reflux. Okay.
And I take it's OME.
Omeprazole.
Yeah,
Omeprazole or Prilosec. That's the brand name. Okay. So with this class of medicines, you have to make sure that you take it on an empty stomach an hour before you have breakfast. Are you doing that?
yeah, second in the morning. Yeah.
Excellent. Now, do you notice that when you don't take it for a few days that it becomes even worse, your reflux?
Really bad.
Really bad. Do you know why that is?
Didn't I teach you?
So,
But yeah,
a lot of people, they have a misconception that it's their body is still sick and that's what's causing them to have more reflux. Oh, they need more of this medicine. They run to the pharmacy and more of the medicine. That's not true. I'll explain. The way these medicines work is in our body, we have certain cells that make stomach acid. It's called HCl. And they have these pumps. So look at it as like a volcano, right? All the volcano was coming out is all this acid. So what these drugs do, they kind of cap this volcano and they prevent it from, your body from putting this acid into the stomach. But your body's still producing all this acid. It's just waiting to erupt this volcano. So the second that you take and stop taking this medication, now it's worn off after 24 hours, you get an explosion of acid into your stomach. And that's what's causing this burning. It's called the rebound effect. It's a genius if you're a drug maker because then you'll be selling drugs
But
forever.
I'll take it in the morning. By night, I'm feeling it again. It's coming up.
Yeah.
It's
And if you look at as a doctor or pharmacist, on the package insert, which is how the FDA approved, it said 3 to 6 weeks a person should be taking the medicine. That's why they sell it in only packages of 42.
5 years.
I know.
They only sell it in packages of 42. Like, why is that, right? It's because that's the course of action, that's the course of medicine that a person should take to help cure that ulcer or whatever issue it is. A lot of people take it chronically is because of that rebound effect. Now, another interesting fact, let's say they actually did a study. This is a published study. They took healthy people, don't have any reflux, never complained of it, nothing. They put these people on this medicine, this omeprazole or other types of the same class, for 2 weeks. They were taking it, and then the researchers took the medicine away. And what do you know? These healthy people started to complain of reflux symptoms. Interesting, right? Healthy people started taking the medicine, boom, now have experienced reflux. What do? Start taking the medicine back again.
Right.
But the problem is, your body doesn't have reflux because of deficiency of this omeprazole or any other type of acid blocker. It's not because it has a deficiency of that medicine.
The food.
It's the foods you're eating,
Stress.
it's stress, it's what time of day you're eating, so your hygiene in terms of your food, and also a lot of times people are deficient in stomach acid, and their food is sitting in their stomach, fermenting, rotting, and it's not being digested. So that's where they constantly feel the food coming back up. So actually by giving a person more stomach acid, if they don't have an ulcer, will actually help to digest their food better and prevent, because the stomach is empty, you cannot have regurgitation. You cannot have acid coming up, right? So that's one thing. Some information about that particular class of medicine. So
how safely can you come off of it?
Yeah.
because of the fact that as soon as you get off of it, you have that explosion coming back up. What you have to do is, with the help of your doctor and your pharmacist, an alternative medicine provider, whoever we decide to work with, you have to make sure that, one, you start to lower the dose slowly. So a lot of times, because it's only available in a capsule, try to take a lower capsule, or have your pharmacist make a solution out of it and then slowly, gradually wean yourself off of it. Or you can switch to another type of medicine that's a little bit weaker. It's like a Zantac or what's the other one? Which Pepsid. Okay, Pepsid. That's gonna it's a little bit milder, and then go for antacids and and slowly. But at the same time, you have to change your lifestyle, because that's what ultimately is causing this to begin with. So if a person eats a lot of fast food, a lot of cooked food, and not eating a lot of fruits and vegetables, you have to switch that around, because you need living foods that have natural enzymes in them, that have natural water in them to hydrate, and it'll add less stress on your body. Because if you're noticing that you get tired after you eat, that's because you're eating the wrong type of food. Food is not supposed to make you tired. It's supposed to give you energy. That's why we eat.
Aren't you supposed to also try to eat an alkaline diet to
Yes.
reduce the acid?
The total acid in your stomach, in your body, yes. So that let me go to weight management, right? That's an interesting topic. There's a lot of prescription drugs now called Glycemia. You have Adipex. You have phentermine. There's Adipex. What other? Oh, we have Ella. No, not Ella. What is that one called?
Belvique,
Belvique, Contract. You also have over-the-counter.
The contract is the new one, right? This is new.
I just did a video on that actually.
Huh?
That's a house.
Starts with an A.
Yeah.
It's bad.
Oh,
What's
you know
the
someone who tried
Yeah.
it?
My cousin
What's the
did
one
it.
that starts with an A that's over the counter, Christina?
Ally?
Ally.
Oh, the
yeah,
Ally.
that one's horrible.
The Ally
Yeah.
is like the one. Oh my
They
god.
put it back on.
They put it back on?
That
Try
is bad.
that.
Me too.
Okay,
Like
so-
wear a diaper.
Oh yeah.
I had to stop in the parkway coming back from Atlantic City.
Yeah.
I was like, no, I don't
So
have
all those drugs,
Yeah, that was a bad one. I tried that.
all those drugs, they work a little bit differently, but overall, they don't treat the cause of why a person's overweight. None of them do.
No.
Yes, they may cause you to lose weight.
Then you can
Most of the time, it's the wrong type of weight, and it causes nutrient deficiencies, especially the ones that prevent you from absorbing fat. By the way, eating fat does not make you fat.
Sugar.
It's sugar that makes you fat. Okay, so very important. You take the sugar out of your diet and switch to eating healthy oils and fats. You will lose weight because your body will use that more energy. Okay. Now, let's talk about any specific questions about those medications that you need to go over. Well, let's talk again. All those are toxins.
Yeah, don't they do damage?
They do a lot of damage. I'll give you an example. A lot of the medicines that increase metabolism, like phentermine, which is it's a Schedule 4 controlled substance, which has a lot of abuse potential. It can cause heart problems. It speeds up your heart and can cause arrhythmias. Okay. Other medicines like Ally or Xenical, that's the brand, that's the prescription version. It causes fat-soluble nutrient deficiencies. Because what it does is prevents the fat absorption. So when the fat comes out, all the fat-soluble nutrients also come out with it. So you have deficiency in vitamin A, D, E, and K, which cause a whole lot of other issues. Then let's talk about the band. You know that they have the surgery for the stomach, right?
A couple of customers that have that.
So first thing, when a person does lose weight, but then they become a wrinkly old bag. You notice that? When people have that?
Yeah.
It's because they lose all their muscle mass. Because the first thing to go when you starve yourself, which is that's what it's doing to you, you lose all your muscle. So your skin gets very, very flabby. And people actually look older because now they don't have the skin is now loses elasticity. So that's number one thing I don't like about it. The next thing, you also are going to be nutrient deficient because now your body cannot absorb a lot of the nutrients that it needs for the stomach acid, like the minerals, like the B vitamins. So you have to be in a lot of supplements, and you can't eat a lot of food. And most people, when they don't eat a lot of food, they get very, very grumpy and agitated. Those are not pleasant people to be around.
It's like that ad to the candy bar.
Yeah.
The other thing that I don't like about it is the fact that, let's see, people say that, oh, lactose now, that's a cure for diabetes. Have you heard that?
What is that?
They're saying that the lap band is like a cure for diabetes because
Oh, yeah,
blood
they say
sugar.
that.
It's because now they can't eat all that
They
junk.
can't eat junk. The
They
sugar,
can't eat
that's all.
all because it's gonna cause more reflux. It's gonna cause other damage when you eat all that junk. Because that's the only reason why their blood sugar and everything is normalizing. Is because now they can't, even if they force it down, they can't have all that junk food. You get, because it just comes right back up.
But it's not healing the pancreas.
No, it's causing more damage. So it's all BS. It's all just to make money. That's, in my opinion, that's what it's for.
Yeah, that's it.
The right way to lose weight.
We should write this down.
One of the people in the pharmacy where I work at, she was like, I exercise, I eat all this, food, whatever, but I still have all this cellulite. Like, I can't lose anything here. When I go on a diet, everything loses in my face, but still my hips and thighs, I cannot get rid of. Right? a lot of people on a diet, the first thing to go is their face, and then that's it, and then everything else stay there. You know, that's not the weight I want to lose, right? You tell yourself lose the other weight. It's because the reason why you have all this weight in the places that you don't want it is because that's a long-term storage for toxins in your body. When your body can't get rid of toxins, what does it do? It stores it away somewhere where, you know, the body, it won't cause more damage. And that's where all this comes into play. It's the midsection and around the hips and thighs. Okay? So the only way to get rid of all that acid and all those toxins is by eating an alkaline diet. Okay? Literally, the fat will melt away. All you need to do is by switching to more alkaline foods like fish, greens, a lot of greens, vegetables, and most importantly, taking away all the acidic foods like red meat, sugar, coffee.
No red meat?
No. Well, if you're going to have less than 20% of your diet should be red, you know, acidic foods. You should still have a mix because a lot of healthy foods are still acidic. But you should make sure that the ratio of alkaline foods is a lot more than what you're eating for than acidic foods. That's the key. A lot of times it's reversed. Like if you go to a restaurant, a steakhouse, they serve you 80% of your plate is a steak, and 2% is, you know, vegetable, and the other is rice or whatever. It should be the opposite way, right? You know, that's the problem.
It should be like garnish, like the Chinese used to.
Yeah.
So when you think
Okay.
about it, it is true.
So Robert Young, there's a doctor, his name is Robert Young, he's a medical doctor. He was actually on CNN, he's got a lot of books out. It's called The Miracle Diet, The Miracle Cure, something like that. And he is a big advocate for the alkaline diet. If you want to YouTube his video, Robert Young and CNN, they have a whole segment, like a few minute segment where he talks about alkaline diet, how it's so important. Not only to make you lose weight, but also get you healthy.
Pain, joints.
Oh, everything.
Yeah, it has a lot of repercussions.
So, the other thing I want to talk about is like natural medicine. Why is that not toxic as medication? There's a few reasons why. And there's a few reasons why it's safe and it can help for many, many things. So you know how drugs, they just use for one symptom or one disease, right? Natural medicine, you can use for multiple conditions, one ingredient. And the reason because in that one extract of an herb or nutrient or whatever it is, it's in a complex of other nutrients, hundreds of nutrients that scientists don't even know yet. They haven't even figured out what actually is composition of a piece of broccoli. What's all the components of it. But we know it can help with cancer, it can help with other conditions. It's because in that complex, it has in there intrinsic intelligence to help to regulate your body. So that way it doesn't make your blood pressure too low or too high, for example, as drugs can. It helps to normalize. It's called adaptogenic ability of herbs or of homeopathy, of other things, of essential oils, for example. They have an ability to help to normalize the body, put it back into its resonant place where it's actually healthy, not putting it to extremes, one way or the other. Okay? So, you won't... one thing I wanted to mention was that for example, when you're taking medication for the heart, for blood pressure, you don't feel blood pressure until it's really, really high. So you have to make sure whoever you know is on blood pressure medicine, they have to have a blood pressure monitor with them, and they have to check their blood pressure at least a few times a day, 2 or 3 times a day, because maybe not now, in 5, 10, 15 years from now, because their body's changing, most of the time the doctors keep them on the same exact medicine. And that can be a real issue where 20 years down the line, you can have this huge issue with your health, and it could be the fact that this medicine was not adjusted to now your new body, which is 20 years older. Okay, so it's very important that periodically, at least twice a year, at least once a year, if not twice, you have to review the medicines with your doctor and the pharmacist. Okay, if my health has changed, improved, should I be changing some of these medicines? Okay, because just to have your pharmacy call your doctor for more refills, it's going to cause you to stay sicker longer. That's all it's going to do. So before you make that call to the pharmacy, okay, refill my medicine, say, when's the last time a doctor actually or a pharmacist sat down with me and reviewed my medicine and see if they're actually still necessary.
Like if you lose weight.
If
blood
you lose
pressure.
weight, you gain weight, you have a child, other things, stress, a big life-changing event. You move to another part of the country, the environment has a lot to do with it.
And the elderly, they don't,
Huge.
heck word. It'll come to me later.
Elderly is a very special population
Yes.
because they metabolize drugs
They metabolize,
very,
that's what it
very
is.
differently than
Yeah.
everyone else.
They don't need sometimes a stronger dose.
Yes, and a lot of times most side effects or the deaths that occur are in the elderly because of overdose or underdose or some combination. I have an aunt, for example, who over her dose of digoxin that she's been taking for 20 years for a heart condition now she overdosed on it. It's because, and they couldn't figure out for like a few months, like why was she feeling so bad? And it's because of that medicine, because the dose was never adjusted. All right, because again, you just refilling the same medicine, it's fine. So you have to make sure you go back and you have to educate yourself, number one, and make sure you schedule a consultation with a doctor or pharmacist so that way to review. It's called medication therapy management. That's one thing I do here, is to help identify which medicines you no longer need, which therapies you do need, and how we can best make you healthy with healthy lifestyle choices. Because don't forget, all chronic disease are preventable and reversible based on your lifestyle choices. Health behaviors is the single most crucial influence of your health, not your genetics. It's your health behaviors. It's what you do. It's actions you take. And the great part is it's in our control. It's in our control. Well, genes we don't have any control over. And thank God that's not just because we have certain genes, the things run in the family, does not mean the person is destined to have that condition or illness or whatever. By the healthy actions a person takes, healthy lifestyle a person lives, all those things can be reversed and prevented.
How about sleep medication?
Perfect. Sleep medicines. There's a lot on the market with sleep, and all of them are, except the exception of Benadryl or something else, Zequel, things like that. They're all controlled substances because they have abuse potential. They work on the brain either to make you drowsy, make you fall asleep. Now there's a new drug that prevents you from waking up.
There is?
Yeah.
Oh my God.
It's a new medicine.
What's
I
that?
recently got a prescription for it and I read, it's the first time I see it.
Really?
And I read, how pharmacology, how it works, and it says,
That's crazy.
prevent the waking cycle.
That's dangerous.
Now, all sleep medicine, all of them, they do not improve quality of sleep. They do not increase restorative sleep. Do not. They do not get you into that REM sleep, which is where you're in a dreaming state and where your actually body's rejuvenating. They do not. So
They knock you out.
they just knock you out. That's
They
it.
knock you out.
They knock you out, and a lot of times you see a lot of phone calls. Oh, this person's missing. Why is this person sleepwalking? Why is the fridge open? Is there a robber? Believe it or not, some of these medicines cause you to sleepwalk,
They do.
and they have a black box warning, which is like an alert to doctors before you prescribe this medicine. Evaluate to see if this side effect will cause damage more than the benefit of this medicine. And again, most of those medicines were not meant to be taken long term either when they were first looked at. A lot of people suffer from lack of sleep. There's many different causes of it, which I can go over. One of it is when a person is having the electronics where it's going to be the iPad or the phone or the TV right before they go to sleep. That's the worst thing to do right before you go to bed. Why? Because what in our body controls our sleep-wake cycle? It's melatonin. Melatonin, how our body makes melatonin, is only at night when it's dark. Right? Our pineal gland is a gland in the brain which makes melatonin. It senses this darkness. Okay, it's time to go to sleep. And then when it's light out, it stops making that melatonin. But when you have artificial light, when you're staring at a screen with artificial light all day long and at night before you go to bed, your body cannot make adequate melatonin because it doesn't know you're looking at a computer screen and it's dark out. All it sees, senses is light. So it's thinking that it's daytime. So it's not going to make you have that natural drowsy feeling that you would at night regularly. So first thing you would need to do is to not have a computer screen or TV at least an hour before you go to bed. Very important.
I can't sleep unless my TV's on.
Well,
A lot of
you're
people
going to
do
sleep a
that.
lot better if
Really?
the TV is off. Yes, it may take you a few weeks to adjust,
Right.
right? But it's going to happen and you'll feel a lot better. Okay, so that's number one. No artificial light when you're about to go to bed. A lot of people are shaking their head. Well, unfortunately, that's, there's
A couple
no...
of times I tried that and then I'm just awake. I'm like,
Okay, I'll explain. Because our body has certain rhythms, right? And to change these rhythms, it takes time. For example, when you fly to another time zone, you feel like crap for the first few days because your body still thinks that it's daytime when it's nighttime, right? So it takes a few days for your body to adjust to this new time. That's why it also takes a few days for your body to adjust to this new lifestyle, new behavior that you're doing. So give it time. Okay? So that's number one. Next is when people have pain. Pain is keeping them up. Okay? So pain can be due to a lot of things. If a person wakes up between 2 and 4 a.m., and most of the time it's because their liver is congested. That's in Chinese medicine, that's what's causing it.
really?
Yes, liver is congested. So, and I guarantee you that same person either is exposed to a lot of toxins through personal care products, or working in a salon, or living in the city with all the exhaust and stuff, and their body is not able to detox effectively. So what I recommend you do is look into a liver detoxification, right, with the help of a qualified practitioner that will help supervise it to make sure you help your body to cope with this toxin and clean out your liver. And I guarantee you, in a few days, after you've completed the cycle of the cleansing, you will not wake up between the hours of 2 and 4 a.m. You'll actually stay asleep. That's Chinese medicine.
What about
I
bladder?
wake up every night at 3 o'clock.
What about bladder when you wake up?
Okay, bladder. So, very common also, especially in the elderly and in women. So it's very important. Don't drink within 2 hours of when you have to go to bed. So let's say if you want to go to bed at 11, at 9 o'clock, no more drinking water, especially alcohol and
That'll
coffee.
keep you awake.
Oh yeah.
It does.
So 2 hours before you go to bed, no water or no beverage or whatsoever,
No
especially
water either?
nothing.
No water?
No.
Oh, I drink a lot of water.
Yeah. So what you need to do instead is
Really?
drink a lot of water during the day.
I
Start in the morning.
didn't know that.
Start in the morning and the midday when you have the most amount of water. Okay? And if you're noticing that you're peeing very often, your body's not retaining any water. So you have to change the type of water you're drinking to alkaline water or add a little mineral salt,
Yeah, pink salt.
Pink salt,
Himalayan salt.
Himalayan salt, pink
Pink
salt,
salt in the water?
to the water, just a
I
pinch.
didn't.
That will help to retain water. And actually in Africa, in the sub-Saharan
Yeah, I
Africa,
didn't know that.
salt was more valuable than gold because that's the only way they would survive from the intense heat.
The pink
The
salt?
body would actually retain
Retain
water.
the water.
Yeah.
Sure.
Okay, so it's very important that you have a little
You
salt
tried
in
it?
your water.
I have it at home.
Okay?
I use it on everything. But I did go to a practitioner
salt,
a while ago,
Himalayan.
and I was dehydrated.
Where would you get?
And she
Okay.
told me to take, I think a half a teaspoon of salt with 2 glasses of water in the morning and in the evening
Mm-hmm.
for a certain period of time to restore the hydration in my body.
Restore the minerals.
Yes,
Yeah, because
pink salt, and that's all I use.
Don't
from now
forget.
on.
water goes where minerals go. So I'll give you a perfect example, medication related. The first medicine that a doctor will probably prescribe to you if you have high blood pressure is a water pill. Make you pee. All right? And the way those medicines work is on sodium, potassium, and calcium channels. And what that means is it opens up those channels in your kidney so that way the minerals can flow out of your body. And what flows out with it? Water. Flows out with it. So that way there's less volume in your blood vessels. Right? Which is a completely wrong way to address high blood pressure because your body still increases it. And that's why most people have blood pressure on 3 or 4 different types of medication because it doesn't solve the issue. So what I want to say is the way our body, so water flows wherever minerals are. So if you have enough minerals in your body, then your body will retain water and you will be more hydrated You won't have to drink as much, and you won't be peeing as much, especially at the bedtime. Okay? So the best way to, the different ways to test your hydration and whatnot, so that's one thing. 2 hours before you go to bed, no water, no beverages. Okay, the other thing is stress. Worrying about things. You're lying down, your eyes are closed, and your mind is racing. Okay, very important. Before you go to bed or during the day, make sure any of those unresolved emotional issues that you have with other people or with yourself, that you take some time and you meditate, or you do some emotional freedom technique, meridian tapping, you do some positive psychology, you say some mantras, something to help you realize, to have closure in that internal conflict that you're having. Okay? Because it's not going to change from one day to the next. Just by you worrying about it, it's not going to make things better. It's actually going to make your body health worse. But unfortunately, we have all these constant racing thoughts. So, you have to take some time and work on emotional health. Again, meditation, exercise is really good. We have emotional freedom technique or meridian tapping, positive psychology, and just talking with a friend. Okay, just have some kind of personal closure of whatever's going on with this unresolved conflict, so that way your mind is peaceful and you can, restfully put your head on the pillow and go to bed. Okay, so it's very, very important. Okay, any other topic that you want to discuss? Medication related?
Antibiotics.
Antibiotics, great one. Okay, this class of medicine has advanced a lot over the century. Started with penicillin, and then a little while later, bugs started becoming resistant to penicillin, and everyone started becoming allergic to penicillin. So what they had to do, make stronger and stronger and stronger antibiotics. And that's a big problem because overprescribing of antibiotics is causing a lot more resistance of new bacterial strains, and it's becoming more deadly. So the antibiotics are getting stronger, they're becoming more toxic, so they're worse for you. They cause a lot of issues, and they also make these bugs stronger, which causes you to take even more stronger medicine. So it's a vicious cycle. So first, the person has to take antibiotics. Let me teach you how to take them correctly, and then we'll talk about how to not need antibiotics, what you can do to prevent that. Okay, so there are many different types of antibiotics, different classes. I'm just going to say them off, and then we'll go over briefly individually. There's tetracycline antibiotics, there's fluoroquinolones, there's sulfur-based antibiotics, penicillins, cephalosporins. There's a whole bunch of them. We had a whole semester we had to learn about in pharmacy school. Each of them have pluses and minuses. Each of them have certain bugs that they cover. Most importantly, each of them have certain side effects for you to be aware of, certain ways to take them. Some of them you have to space away from dairy products or iron or calcium, minerals. Others you can be out in the sun. Others you have to take with food, without food. So there's a lot of issues. Most importantly, whenever a person's on any type of antibiotics, 2 hours after that dose they just took, take a potent probiotic. Why? Because antibiotics, most of them, they're like a machine gun in your body. They wipe out everything. All the good bacteria. Like a shotgun effect. They just kill everything. Right? Things that protect. So a lot of women, especially, they notice after antibiotic use, they get yeast infection.
Yeah.
Why is that? It's because good bacteria in your uterus and in your vagina, they protect you from these pathogenic bacteria. But now that you're taking these antibiotics, they wiped out everything, and now this bad bacteria and yeast can grow. Right? And then you have to take another antifungal medicine, which has a lot of issues associated with it. So, 2 hours after every dose of antibiotic, take probiotic. Now, before the first pill of the antibiotic you take, you have to be certain that you're going to finish the course, whatever it's going to be. Because if you don't finish the course of antibiotics, you are killing the weak strains and you're strengthening the stronger ones. So you're actually causing more problems for yourself and everyone else around you.
If you don't finish
the course. Yeah.
The course.
So if you decide that you're not going to finish the course, don't start taking that first dose.
I've done that, taking a stop in the middle and then gotta go back to something else.
Exactly. A lot of people notice that they get sick again,
Yeah.
recurrent infections. It's because they didn't finish the course of therapy. Okay, so very important. If you're going to start, you You have to finish, and 2 hours after every dose, take a potent at least 20 billion to 30 billion units of probiotics after every dose. Okay, very important. Now, how do we prevent needing antibiotics? Okay, now we have to look at the environment of where our body is. It's like real estate. So if you have a ton of buildings, like New York City, in Manhattan, if you have all that buildings there, and a contractor wants to build a new building, where are they going to build? There's no space. Everything is taken, right? So, for example, in our body, the good bacteria, they populate all this area in our body. Let's say in our bladder, or on our skin, or in your lungs, all the places where you can get infections. You have all these good bacteria. They take up all the space, and they're good. You have a friendly relationship with them. When these bad bacteria, someone coughs on you, or you get it from the environment, it has nowhere to grow. There's nowhere to sit and thrive, causing you damage, because there's no space available. It's overpopulated by the good bacteria. Okay, so you have to make sure that you are eating fermented foods, and if not, you're taking high quality probiotics. That number one, to protect you. All right. Now, what causes your bacteria, good bacteria, to go down in your body? Stress. Whenever you're stressed, your body becomes acidic, the environment changes, and now your good bacteria don't have the same good environment to live in. They start to die, and now your body is vulnerable to an infection. So a lot of people, they notice when they don't sleep, when they have a big deadline, family stress, they wind up getting an infection. Yes?
Mm-hmm.
It's because that stress has caused your body's environment to change, and now you are susceptible. So the bad guy isn't the bacteria that cause you, bronchitis or cause you a skin infection or whatever. That's not the bad guy. The bad guy is your stress, that change environment of your body, which now put you at risk for getting an infection.
Wouldn't also lack of sleep do that too?
Of course. Yeah, I mentioned that. Lack of sleep will definitely cause your body stress, because sleep is very restorative. Okay. So you have to make sure you take good quality probiotics, and you decrease the amount of stress that you're under. Now, or stress management. See, and like for example, a baby. I have 2 kids. I'll do 2. So when, let's say, they don't like something, they cry. Next second, they start smiling and playing and doing whatever. Right? Because they're in stress in the moment, and then that moment passed, and now they're happy again.
Mm-hmm.
Right? You all notice that with kids.
Yeah.
It's because that's how we have to be as adults. We can't keep holding grudges of things in the past. Right? Okay, they happen, there were situations happen. I want to go into much detail. But it's over. It's not happening right now. So why are we stressing about it? Because emotionally in our brain, whenever we think about a traumatic event, our body has the same reaction as if we're experiencing the event right now in the present. Our brain has no difference between us thinking about it and actually going through it. Okay, so you have to make sure, spend more time around children. You'll know exactly what I'm talking about. So, does anyone have any more questions?
Memory loss.
Okay, Alzheimer's, right? Dementia.
Dementia.
Huge. It's actually called diabetes type 3.
Really?
Yes.
Oh,
Why?
that's another one. Okay.
Because they found amyloid plaques, which basically what that means is sugar molecules have attached to proteins in the brain, fat in the brain, and now they've changed it, and now because it's browning effect. So whenever you caramelize meat, what do? You add a little barbecue sauce, some sugar, and then you put on the heat, and it caramelizes. That's caramelizing your brain. That's what it's doing. Alzheimer's. So what you have to make sure you do is decrease the amount of sugar in your body that you're ingesting.
Really?
Also, stress increases the amount of sugar in your body. So everything goes back to stress.
Stress, that's what I'm going to say.
Stress
that.
is
Stress.
Stress.
And sugar.
Believe it or not,
And it's not sweet.
stress
No.
is more damaging in terms of free radicals than cigarette smoke.
Ah.
So you think cigarette smoking is bad? You got to take control of your stress. That's the most important takeaway point from today, because it affects so many parts of your body. Okay? So that's number one. The second part is different toxins in the environment, which make the barrier in our brain weaker, they mop up the receptors and chemicals in our brain, like aluminum, mercury, so like heavy metals, volatile toxins. You know, like when you open up a new box of something, you get that whiff of plastic, right? That will cause brain damage. Imagine people that work in an environment or constantly in not a well ventilated area. That's really bad. And these things don't happen overnight. It takes years and years and years and years to develop. So that's the problem, especially the young population. They don't feel the negative effects of it, so they keep doing all this bad stuff that they're okay with because they don't feel negative effects of it. And then when it gets to that point, it's too late because now the damage has been done, and it takes a very long time, and it's really hard to reverse, if at all, maybe a few percent. Okay, so it's very important.
You can't reverse dementia.
You can stop it from progressing. You know, there are some cases where it has been reversed, but to an extent, not fully, because again, the damage has been done. Okay.
Unless you can grow more.
Which you can, but again, it takes a lot of effort, and most people, most families, are not going through that effort because it's a lot of work. A lot of work. Everyone see that movie Notebook?
Yeah.
So you know when the guy was now many people are committed as that husband is to the wife. You know. So that's what it's going to take. So how to prevent it? You have to take a lot of antioxidants, fruits, vegetables. Again, it's going back to the same fruits and vegetables, going back to lowering stress. It's the same answer for every issue. All chronic diseases stem from health behaviors. If you live a healthy lifestyle, you will not have any of these issues. Yes.
What about coconut oil? I heard
Coconut
that's
oil
very
has
good for.
caprylic acid, which actually is a type of fat that helps to nourish the brain. Our brain can feed off of sugar or it can feed off of fat. Coconut oil is really good as an alternative source of energy for the brain.
So when you just
I
take it
read
like
that
you
it
Yeah.
has helped people with dementia.
Of course, because it's an extra source of energy for the brain, so now it can actually function.
You take that?
I
My
actually-
mother was diagnosed with brain injury, and actually coconut oil did help her.
Yeah,
Really? Yeah.
I even feed it to my kids, which are less than 2. It helps the brain develop.
It's the oil.
You can
Helps
take
you
it
lose
at
weight,
all
too.
ages.
Helps you
But
lose
I
weight.
heard that it's very good.
Yeah, it even helps you lose weight because it uses
Yeah, I heard
it's an
that too.
extra energy source for your body. So your body can start to burn fat
Yeah.
instead of burning sugar.
You know, I was reading it also
No,
metabolizes
but I heard
differently.
that too.
Yes,
I
then
know
on the
that
That's
a long
part,
time.
one of the reasons why it's a healthy fat.
Yeah,
When
coconut
my
oil is
mother
amazing.
mentioned,
That's
someone
why
wanted to make a
it's got
take
sand.
that long time.
Antiviral.
She's
It
also
was a
like
whole
that,
thing.
so
Yeah.
Dr. McCullough,
That's why
Yeah.
at least I got a
almost like
connection.
It's very good.
really?
Very good as a helpful.
It is?
I use it every day in my kitchen.
It's good internally and
Oh,
externally.
yeah, no, that's true.
Yeah, it is. It's like a miracle. And it used to get such a bad rap that was bad fat.
Well,
Don't
again,
eat it, don't
back
eat
in the
it.
day, all fats were bad. Oh, let me talk about cholesterol.
Oh yeah.
That's a
Oh,
big
yeah,
lie.
I don't have that.
Yes, you heard me say it's a big lie. High
Sugar.
cholesterol. High cholesterol does not cause heart attack. Okay?
Okay.
Now, let me explain. Because I would be attacked by all these medical doctors right now. They'll be taught differently.
Yeah.
Yeah.
Why? Because these cholesterol medicines are one of the top selling drugs. Each one makes billions of dollars. You know, so there's a lot of propaganda going around. So this is the truth. How does our body get high cholesterol? Right? It's because, one, we're eating less fat. Eating cholesterol helps to lower cholesterol because the body doesn't have to make as much. That's one. So have cholesterol. It's not going to kill you. Your body would make more cholesterol if you didn't eat cholesterol than if you would ingest it. Okay. Now, how in all animals, none of the animal kingdom have high cholesterol. You've never seen an animal biopsied and they say the reason why this animal died is because of high cholesterol is plaques in their arteries. None, not one report. Unless it's a dog or a cat that feeds off of human junk food.
Right.
Okay, now this is my second point. How do they simulate high cholesterol in animals, in mice, when they're testing drugs? What they do, they go through like a little probe into the artery and they scrape the artery wall with a little probe. They actually scrape and damage the artery. And what do you know? Next day, they wake up They take their
Cholesterol.
blood, high cholesterol. How?
See it.
So you see the connection there?
Yeah, I know.
It's because of damage to the arteries by all the junk and toxins that we're eating that's causing damage to the arteries. And what is cholesterol? It's like a band-aid for our body. It tries to patch up the wall of the artery so that way the blood doesn't leak out,
That's interesting.
right? And because you're constantly ingesting all this garbage, you're causing more damage to your arteries, so you have more cholesterol being made, trying to patch up all those injuries that you're making into your body, in your heart especially. Okay? Because again, high cholesterol plaque buildup does not occur in all animals that eat fruits, vegetables, things that are in nature. Only happens in humans because all the junk we eat. And all animals, they do a lot of exercise, a lot of running around. Their blood is constantly moving. We just sit all day. We sit in our car, we sit at our desk, we sit in our car, we sit on the couch, we lie in bed. Okay? So we have to get moving. It's very important. Okay? So the answer is not taking cholesterol lowering medication. The answer is changing your lifestyle.
But cheese is bad for you, right? Cheese. I love
What
cheese.
type of cheese? American cheese, 100%. It's all plastic. It's garbage.
Raw cheese? It's great.
Raw
They
cheese
have
is
raw
the best.
Well, how is cheese
Right.
made?
never
It's
tasted raw
fermented.
cheese. Is it
Fermented
good?
cream.
Fermented cheese.
So
You know?
from the
Oh, I'll give you an example.
What about
raw
goat cheese?
cheese.
Goat
Did
cheese.
you ever try that?
It
Raw
depends
cheese?
on your body's sensitivity.
Yeah.
So some people are sensitive to certain proteins in goat and milk and sheep and whatever else. So you have to make sure that before you ingest, if the food is not agreeing with you, then you have to stay away from it. If your body can handle those proteins and you're fine, then you can have cheese and have milk, have all these things, but you make sure they're raw, organic, they're not pasteurized, that they are good quality. If something has an expiration date on the shelf for 2 years,
Oh, God.
it's
Yeah,
not
it's-
good.
it's got
Things in
preservatives.
nature rot. They're supposed to decompose.
Yeah. It's like the Twinkie. They said they kept it for a year and it was
20 years.
perfect.
Oh.
for
Yeah.
whatever. Yeah, it was
I always look at dates though.
Yeah.
But
I'm
Isn't the
with that.
reason for the raw because the raw has the enzymes in it, and when they apply heat to it, it kills the enzymes?
Not only does it kill the enzymes, it kills most of the beneficial nutrients of
that's
it.
why it becomes an unhealthy food.
Yeah, exactly. It becomes more damaging instead of life promoting. Okay. So let me go over some of the key points because I don't want to leave you guys depressed when you walk in here.
Can I ask
Most
a question?
Yeah,
What
sure.
are fermented foods?
Perfect question. Most people are not familiar with this because we're not taught this on a regular basis. Fermented foods are foods that have been cultured, which means they're living food, whether it be dairy or vegetables or meats even, that allow bacteria or beneficial bacteria in the environment to pre-digest the food.
Okay.
When they pre-digest it, the nutrients in the food become more available, and the good bacteria help to populate our body, protecting us and helping to modulate our immune system and protecting us from getting other diseases.
What meats are fermented?
You can have aged meat.
Oh, like the
Yeah.
age of steak?
Aged
Like
steak.
that would be
cheese,
okay?
Stuff like
Yeah.
that. Okay, gotcha. Okay.
That's an example of how they ferment.
Right, okay.
Raw
Obviously,
sauerkraut, any
yeah.
kind of raw
Sour.
vegetables.
So the
Kim-
vegetables they gotta
kimchi.
be all raw, like escarole and sweet chard. You can't eat that raw. Well, the
No.
escarole you could put in the
No,
salad.
no, fermented is different than raw.
Okay.
fermented takes raw vegetables or milk that's
Vinegar,
been and not and you
Like
don't add vinegar.
kefir is considered.
Kefir. So what you do is you take these vegetables, you add a probiotic culture to it, you add a little bit of salt, and you let it sit on the counter covered lightly for like a day or two. And then you'll start noticing it comes bubbling a little bit and it will taste a little acidic. It will not taste rotten. It will taste a little acidic.
Oh,
Where did their probiotic culture?
Either you can buy it or you can
what's up
from
about
from
culture?
um, from Cultures for Health or Body Ecology or Mercola.com has a culture, or you can just take fresh cabbage, chop it up, and put it in with any other vegetables that you want to ferment. And there's good bacteria on the cabbage that actually will grow and it will produce a fermented product that's healthy. So make sure
Is that how they make sauerkraut?
Yeah.
Interesting.
you take salt and
Salt and water and
no water.
No
you,
water.
you can just take salt and the cabbage and just smush it together and just leave it out. That's it.
And
Again.
then when it becomes acidic though, like
Exactly.
And
But
then
that
you
is that acid,
and then you eat it raw. You gotta
healthy.
still cook it.
eat it raw. That acid is it's pre-digesting the food,
Really?
and it's probiotic, so it actually will help protect and help to
Good
heal your
bacteria,
body.
yeah.
I gotta tell you, one time I was making the zucchini
Yeah.
and I cut it up and I put like a little oil, a little salt and pepper, and I forgot it. I forgot it overnight. The next morning was like really gross.
Yes.
It smelled the whole house.
Okay.
First of all.
Okay.
Try.
Good example. Now, when I mentioned to everyone about it's sour, it doesn't smell rotten.
No, it became like sour.
I know.
It's like, ooh.
So there's a big difference depending on the type of bacteria that grow on it, or other cultures, but yeast or something else. Fermentation happens in a controlled environment. You are controlling the environment, and you are promoting the growth of beneficial bacteria. You're not promoting the growth of bad bacteria, pathogenic bacteria. So if something does not taste like pleasant, it tastes rotten or smells rotten, it means the wrong type of bacteria or culture is growing there. You don't want that.
No.
Fermentation is a very controlled thing. A lot of health benefits. So what I recommend you do, if you're interested in that, go online, Cultures for Health or Body Ecology or even Mercola.com. You can do some research and they will go over with you what's the right way to prepare fermented foods.
Or
Or
you
just
buy
get
it
sauerkraut.
Or you buy it
You
fermented.
can buy it.
Or kimchi.
Ah,
They have it? They have it?
Where?
Where?
Any health food store.
Trader
Really?
Joe's.
Yeah.
Like Trader Joe with the
Yeah.
Trader
No.
Joe's has, I don't think they have that many products, but they do have a raw sauerkraut, and it's actually pretty good.
So
Yeah,
just as some
that's
closing
kind of-
comments to today's event, I want to make sure that you understand that all the information I share with you today is from a point of view of being empowering. Because now you're more educated about medications, you're more educated about your health, and the fact that your health is in your control as an individual, depending on your health, like your lifestyle choices. Okay? Our job as health professionals is just to coach you on how you can best support yourself having a healthy lifestyle. Because as an alternative medicine practitioner, I don't heal your body heals your body. All I'm doing is helping you live a healthy lifestyle, teaching you how to minimize the toxin exposure, helping you realize and get more nutrients from the food that you're eating, so you can absorb, help to minimize the stress, and help to increase your body's resistance to stress. With that three combination, now your body is able to heal itself. Again, the natural state of our body is to be healthy. It's not to be sick. So you have to keep in mind, whenever you cut yourself, your body automatically starts to heal itself, right?
Yeah.
Your body is in the natural state of health. And if a person's sick, especially for a long time, it's not that, oh, this is the way it is and I have to deal with it. No. You have to just minimize the toxin exposure, increase the amount of nourishing things in your life, and minimize the stress, whether it be environmental, social, emotional, whatever. Okay? So we do that, I do that with practitioners, and we do that at the center here. And it's, again, you are empowered. It's not your genes that are controlling your health. It's your lifestyle choices, your health behavior. So that's the most important thing. And always ask questions. Before you put any toxins, especially drugs, in your body, make sure you are completely aware of all the risks and benefits. And understand,
I do my
these,
nails.
oh, that was the third thing I mentioned. Right patient, right dose, and right time. So you make sure to give it to the right person. You are given for the least amount of dose necessary and for the shortest amount of time. That's the right patient. That was the most important.
You knew you'd get it.
Yeah. All right. Thank you guys, everyone.
Thank you.
Thank you.
And
Interesting.